Hello, my name is Toru Deguchi, Graduate Program Director in The Ohio State University. Today, I would like to introduce one of our recent studies. The research topic is related to the treatment effectiveness with aligner therapy. By attending several meetings and conferences, you will hear so many good things about this aligner therapy. It is true that in some cases, you will be able to treat severe Class 2 or deep bite cases with aligner therapy. However, there seem to be many cases that had to go through a significant number of refinement process after the last tray, and you will find many cases that were treated by general dentists and not finished well and ending up at your office. Therefore, we wanted to know the limitation of the Invisalign therapy and identify the specific problem that Invisalign may have. We especially focus on the case selection, assessment method, and statistics. I will then switch to our first author, Jia-Feng Gu. Now, we are continuing several research related to Invisalign. We are analyzing the relationship between the time wear and the effectiveness of tooth movement, and also accuracy of ClinCheck and effects of different attachment types in various tooth movement. I hope our research will provide some important information with the use of Invisalign. Thank you.
My name is Jia-Feng Gu. I'm the first author of this study. As you may know, there has been dramatic increase in cases treated with Invisalign in the past few years, with about 4 million cases treated till last year. Since 1999, when Invisalign was first introduced, various types of improvements, including tray material, attachments, and treatment algorithms have been developed by Align technology, which expanded the ability to move the teeth in ideal position. The hypothesis of our study was that there will be no significant differences in the treatment effectiveness, efficiency, and malocclusion improvement between Invisalign and fixed appliances. Our study is a retrospective case control study. We looked at about 1,500 fixed appliances cases and 250 Invisalign cases in our OSU Orthodontic Clinic archive treated between 2009 and 2014. Here are our inclusion criteria to match the pretreatment malocclusion between the two groups and eliminate any early termination cases. 48 cases from each group were selected. What we found is the Invisalign group tend to be older than fixed appliances group, which is the only pretreatment variable which is significant. We also found that there is no statistically significant differences in pretreatment PAS scores, post-treatment PAS scores, and the weighted PAS score reduction, and neither of their 8 individual components. However, the treatment duration for the Invisalign group was significantly shorter than the fixed appliances group by about 5.7 months. To compare the treatment efficiency of the two groups, we evaluated delta W power per month. The Invisalign group was not significantly different compared to the fixed appliances group in reducing weighted PAS score per month of treatment. In our study, all cases in both groups were improved based on Richmond criteria with at least a 30% reduction in PAS score. However, using our definition of great improvement, which is either a reduction in PAS score of 22 points or a final PAS score of 0, logistic regression analysis indicates that the odds of achieving great improvement in Invisalign group was only 0.329 times as likely to achieve great improvement in the fixed appliances group after controlling age. We further analyzed the distribution of percent reduction in weighted PAS scores between the two groups. Our data indicated fixed appliances are significantly more effective to reduce weighted PAS scores than Invisalign.
Excellent.
Okay, great.
All right.